Welcome, everyone. Welcome to this webinar organized by the CASH working group of the Global Nutrition Cluster. We are going to give another minute for participants to join, and we will start. I can see that we already have 65 participants joining, so let's make a start. Welcome again to this second webinar of the webinar series on the use of CVA for nutrition outcome. This webinar series focuses on the design of cash and voucher assistance when it is included in a nutrition program. And it's the second of a series of webinars. The first one was organized a couple of weeks ago and was a real introduction to the topic, an overview of the tools. And today we're going to focus more on one of these tools, the cost of the diet. So some housekeeping rules. As you can see, the webinar is recorded and is translated. The translation is accessible by clicking the globe icon on the bottom of your screen. Translation is available in French, Spanish, and Arabic. So for the other languages, la traduction est accessible en cliquant sur l'icône du globe terrestre au bas de votre écran. Et en Spanish se puede acceder a la traducción haciendo clic en el icono del globo en la parte inferior de la pantalla. Next slide, please. So as I was saying, this is the second, and we had a very interactive first session with a lot of interesting questions on the different tools and methodologies. And why are we organizing a webinar series on how to design cash and vouchers? Because this was identified as one of the main challenges by CVA and the nutrition practitioners when they design their programs. So we really wanted to respond, and we decided that a more dedicated session on each one of these tools will allow practitioners to be more confident and to be better equipped in their program design. Next slide, please. The CVA working group under the nutrition cluster is one of the thematic group. The organizations that are highlighted here are really just the organizations that have contributed to the organization of this webinar, but we have many others and the supporting donors as well. Next slide, please. What are the objectives of this session? So as I was explained, we really wanted to provide a more in-depth orientation on the cost of the diet as a methodology. So we want to explain better the tool, how to access to cost of the diet studies and software. What are the potential uses of the cost of the diet, which is not only used for the design of CVA, and what are the opportunities that you can have in modeling different program interventions. We also want to respond to some of the frequently asked questions that we receive. Is the cost of the diet too complicated? Is it a heavy process? Is it costly? So we're gonna have an overview of the resources needed to undertake a cost of the diet assessment, and also how to access to knowledge and competencies. We are also going to have a little session to present what are the linkages between the cost of the diet and the field and nutrient gap. That is another very important tool and methodology when we want to understand the market system and the design of a CVA program. Next slide, please. So let's have a look at the agenda. We are going to start with the content really of the webinar, on a presentation on the tool, methodologies, and case studies that will be done by my colleagues, Lily Schofield and Aureliane Baricot from Save the Children, which will be followed by a presentation from WFP on the linkages between the field and nutrient gap and the cost of the diet. And we will end with the Q&A session. Next slide, please. Today's with us, we have myself, Marina Trippalli, one of the co-chair of the CVA working group, Diane Moyer, the other co-chair of the CVA working group. We have as main panelists and presenters, Lily Schofield, Senior Evidence and Learning Advisor from Save UK, Aureliane Baricot, Regional Lead for Health and Nutrition and WASH from WCA, and Zebiba Ayene, Food System and Nutrition Analyst from WFP from Rome. Diana, do you want to quickly introduce yourself?
Good morning, good afternoon, everyone. My name is Diane Moya. I'm a nutrition advisor for Concern Worldwide, and I'm along with Marina, the co-chair of the GTW for the use of CVA for nutrition.com. Very glad to see you all, and I hope you will really enjoy this webinar. Thank you, Marina.
Thanks. Next slide, please. And I will now hand over to Lily Schofield from Save UK for the presentation on the cost of the diet.
Thanks very much, Marina, and thanks very much for inviting us to come here. It's great to be with you all today. Myself and Aurelian are going to tag team on this presentation just to keep things interesting. But before we get into kind of the background on the cost of the diet, we'd like some information from all of you. So if we can launch the first poll question. And we can also move to the next slide. Yep. So for those of you working through translation, the first question is, what is your previous experience with cost of the diet? And you can select the answer that fits you the best. So A is no previous experience. It's your first time to hear about it. B is limited. Maybe you've heard about it. C is some. So you may have read a cost of diet report or looked at a results brief. D is substantial, so you maybe were involved in a cost of diet assessment, and E is extensive. You've maybe led a cost of diet assessment, worked directly with the software. So we'll just give everyone a few minutes so we can see kind of the spread of experience in the group. So it looks we've got most people have answered. A few answers are still coming in. But broadly, it looks like we're on the lower end of exposure and experience, which is great. So it means that it'll be new and useful information for most of you. So I think we can probably go ahead and wrap the poll at this point. And share the results. So yeah, it looks like we've got most people kind of with either very limited or no previous experience, or maybe have read some of the outputs before, and a few kind of more experienced users. So that's great. That just helps us also know kind of in terms of what to focus on and the level to focus on. So we can go ahead and move to the next slide. So where did Cost of the Diet come from? Why did Save the Children develop Cost of the Diet as a tool? It really came from wanting to answer this question, which was, can the poorest and most marginalized communities and families that we work with afford nutritious diets? Social behavior change, communication, nutrition education is well and good, but can people actually economically afford to follow that advice that we give them? Next slide. So what is Cost of the Diet? So Cost of the Diet is both an innovative method and a piece of software, and Save the Children developed it kind of starting in the late 90s and early 2000s to kind of address that question that I just showed. And what Cost of the Diet does is that it estimates at the lowest cost the quantity and combination of locally available foods that are needed to provide a typical family or individual with their recommended intakes of protein, fat, energy, and 13 different micronutrients. Next slide. Oh, my map's gone a little bit funny. Apologize for that. But just to give a sense of the scope of the use of the tool, as I said, the first iterations were kind of developed in the early 2000s. It's gone through several iterations and improvements since then. It has been quite widely used in over 47 countries by NGOs, UN agencies, governments, and academics. The methods, which are kind of the mathematics behind it, have been published. And you can go read that paper if you'd like. Next slide. So how does Cost of the Diet work? This is kind of a schema of the different information that it combines. And really at its heart, what it does is it combines information about nutrient needs and food availability to come up with hypothetical diets that kind of meet requirements at a low cost. So you can see that there's a set of blue boxes there, and those boxes represent the information that's already preloaded within the Cost of the Diet software. And kind of if we start on the specification side, what we have is information about the nutrient requirements of a whole bunch of different types of individuals. So in the databases, we've got men and women of different ages, body sizes, and activity levels. You've got kids of different ages, and you can basically from that build families or individuals that represent kind of what you're interested in looking at. And we also have information around what are the different nutrient requirements for those individuals, what are their min and max kind of constraints. We don't want to have too much energy coming from fat, for example. We don't want kilocalories to exceed people's needs because we don't want to create diets that would lead to overnutrition, etc. So there's a whole set of constraints and specifications. And on the other side, we have the information about foods. So in a Cost of the Diet, what you do is you need to tell the software what food is available and at what price. So that's where kind of the market surveys come in. So you can see in the orange-ish boxes, what you need to enter as the Cost of Diet analyst is what are the foods available. Now we have a whole bunch of existing food databases in the software, and you can match the foods that are available in your local markets to those foods. Or you can also add new foods as well. In addition to what foods are available, you also enter information about what's the price of those foods. And the software then calculates a price per 100 grams and uses that to run the calculations. And the last kind of piece of information that's kind of critical for building a Cost of the Diet analysis is dietary habits. So this would come from usually focus group discussions and key informant interviews with local communities about taboo foods, also staple foods or foods that they eat every day or every meal, and other things about dietary preferences so that you can apply some constraints so that the model that the software generates is going to be a bit more aligned with people's eating habits and patterns. And so what happens is the software combines all of this information using linear programming and basically looks for the lowest cost way to meet all of those specifications that you've given it. And it generates a hypothetical diet and tells you the cost of that diet. If we have information about people's income, and their expenditure, then we can also add that to the analysis and look at the affordability of that diet and the gap between what that diet costs and what people can afford to pay. And that's also where a lot of the modeling that we do with cost of the diet comes in, because we're able to change a lot of these parameters and see what the impact of those changes have on cost, on composition of the diet, and on affordability. Next slide, please. So there's a couple of different ways to generate the data that you need for cost of the diet. I'm going to go through the key steps here and what would be a primary data collection scenario. You can use also secondary data if you have that available. But in this case, I'm going to focus on the primary. So the first is defining your assessment area. Typically, we do cost of the diets at a sub-national level. So at a livelihood zone or a district level, basically trying to look at an area where the market access is going to be relatively homogeneous across the area. Then we generate our food list, which is kind of listing all of the foods that are available. Usually we talk to local staff, local our data collectors, local individuals that will know the markets quite well, and we start to build our food list, including kind of wild foods, own-produced foods as well. And we'll add to that list as we're going through data collection as well. And then we visit a sample of markets that are representative of the area. And markets can be anything from, a large-scale open-air market to a few kind of itinerant traders that come and set up a stall for a couple of hours in a village. So the definition of market is going to depend on the context. And we collect information about all of the foods that are sold in that market, at what price, and we take weighted samples of those foods so that we can enter that in and calculate a cost per 100 grams. And then we also, as I said, collect information about people's dietary habits and preferences through key informant interviews and focus group discussions, usually in communities that are near to the markets where we are surveying. And the last piece of information we need to collect or define is the typical family or individual that we're interested in kind of modeling for. Now, in the software, you can build lots of different types of families and different sizes, but usually within an assessment, we focus on one family that's relatively representative of an average family in that area. Next slide. So here I'm going to hand over to my colleague Aurélien to take you through the next section.
Thanks, Lily. So here I will just present briefly what does cost of the diet tell us. So basically there are different questions that the tool will help us to respond to. Is it possible to meet energy and nutrient specification in using local food? And if not, why? Or what nutrient specifications are most hard to meet? What is the cost of the foods identified? Is this diet affordable? And if not, what might be done? So we'll go through a few examples just to see the response when we use the cost of the diet to those questions. Next slide, please. So here it just how to describe and to see if how we can meet nutrient requirements with local foods. As you can see on this graphic, in this specific intervention area where we conducted this assessment, energy and protein requirements were met. So here, if you see on the 100% is basically the 100% nutrient requirement. As we can see on the left, right-hand side in the graph, there are few nutrients that has not been met in terms of requirements. Calcium, iron for one of the livelihood zone which has been assessed, and zinc. So these are some of the results from the cost of the diet tool that could tell us if the nutrient requirement has been met in a specific livelihood zone. Next slide, please. So here we will launch the second pool questions. Typically, what happens to the cost of the diet when we add food habits information into the analysis? So there are three questions. The cost goes down, the cost doesn't change, or the cost goes up. We'll wait for a bit longer to have a significant number of responses. I think we can close the pool. So 51% you responded that the cost goes up, which is correct. 24% the cost doesn't change, and 25% the cost goes down. So we'll just go to the next slide to just describe what we just asked you. So here it's an example of a recent study, cost of the diet assessment that has been conducted in Malawi last year, if I'm not wrong. As you can see on this graphic, we can see all the different diet that has been generated by the cost of the diet software. So there is 4 diets that are generated by the software. The energy-only diet, so that meets energy requirement, micronutrient diet that meet energy and protein and fat requirement, nutritious diet that meets the micronutrient requirements, but this is based from all the food available in the market, so basically from your market data. The staple adjusted nutritious diet, our colleague from WFP that will present later will cover this part on what are the differences between those different diets. And the last diet that has been generated by the software is the food habits nutritious diet that take into consideration food habits. As you can see, the cost of the diet has significantly increased when we speak about the energy-only diet from 228 USD dollars up to more than $1,200. So this is just to show you whenever you run those different diets within the software, the food habit nutritious diet usually is the one that the cost is much higher. Next slide, please. So here is just to describe a bit 2 different cost of the diet assessment that has been conducted. This is really to explain a bit about the function of the software and how the analysis is done in terms of affordability gap. On the right-hand side, you'll see this affordability gap analysis. So basically, you will see that, again, you see the percentage of income, 100%. You will see that for the very poor, the middle, and the better off household. So you will see that when we include all the different costs of the energy-only diet, which is a blue histogram, in red, it's the extra percentage of the cost of the nutritious diet. In green is the extra cost, percentage of extra cost of the food habit nutritious diet. And in purple is what we call the percentage of the cost of non-food expenditures. So you will see that for those 4 different wealth groups, those cannot afford the food habit nutritious diet, nor the nutritious diet. Another example, it's similar to this one, is just to show you basically the red curve is, again, the income available for a very poor household. So the income related to food expenditures. So basically, you have the total income minus the non-food expenditures, and here it reflects the income that could be used for food expenditures. The blue histogram, again, it's energy-only diet, where in this case, the very poor household could afford the energy-only diet cost. The nutritious diets, the yellow histogram, where we could see that this very poor household cannot meet the cost of the nutritious diet, and the same and even larger for the food habit nutritious diet. Here we put the example of 6 individuals because it's average size of typical household. This was done in Burkina Faso, and this is based also on the standard they use for cash transfer programming. Next slide, please. So, what are the different uses of the cost of the diet tool? So here we try to just show you the different uses that has been so far since we've been conducted various assessments, as Lily showed you just previously. We can use the tool for early warning indicators as part of the existing early warning system. We can use the tool for designing nutrition sensitive intervention, CVA, homestead food production, livestock rearing. Also, we could use it for advocacy purpose and policy change for nutrition and social protection programming. How we can use it also to design micronutrient and dietary supplementation. And one part that we discussed even during the first webinar, how the tool could also support and be part of the design revision of SBC strategy. It could be also including the recipe development, and also the use of this tool for research purpose. So I will hand over to Lily to briefly go through some of the uses that has been conducted.
Thanks, Aurélien. Next slide, please. So I know we had a whole other webinar around kind of calculation of cash and voucher amounts. So I won't spend too much time on that. But this is just a kind of another example from a program in Myanmar that was developing a pilot for a maternity cash transfer aimed at kind of improving nutrition in the first 1,000 days. And we were kind of developing the initial pilot with an eye towards demonstrating, if this type of intervention could work in the country and potentially see if the government was interested in scale up. So in this setting, we were working in a program across 3 different livelihood zones. So the letters here just represent the different livelihood zone acronyms. But what we did is we did cost of diet in each of those livelihood zones and then looked at the average monthly cost of that diet for a child 12 to 23 months. And that averaged out at just under 10,000 kyat, which is the local currency. And then we had information from a household economy analysis about kind of average health expenditures, which worked out to about 3,000 kyat per month. And so for our initial pilot, we combined that amount, we rounded it to 10,000 kyat and added 3,000 and did a 13,000 kyat per month transfer for the initial pilot. We got some good interest from the government, and it was interest to scale the program. It got scaled up at a level of 10,000 kyat because that was a nice round amount. And there was a variety of reasons for that, but kind of around 10,000 kyat. And then that was later increased to 15,000 chat. Next slide, please. That pilot program was scaled up in another region of the country and tested in a 3-armed RCT where we looked at cash plus social behavior change or nothing. And we did see actually it had a very positive impact on moderate stunting. So we reduced stunting by 4% overall, with most of that occurring in the moderate stunting range. So that's just an example where cost of diet informed a program design that then kind of evolved over time and got scaled up to a much wider scale. Next slide, please. So another thing that we can do within cost of the diet is model the impact of different micronutrient or supplementary dietary interventions. So these are 2 different examples. The one from Burkina Faso is looking at kind of modeling the impact of a relatively standard CSB plus and fortified oil ration on the cost of a diet for breastfeeding women and a child 12 to 23 months. And you can see that in the case of the women, the ration reduced the cost by 10%. And in the case of the child, it reduced the cost by 20%. So this is one of the features of cost of the diet with those parameters that I talked about. Changing those parameters, you can see the potential impact of different interventions. Another example that's often modeled within cost of the diet assessments is multiple micronutrient powder interventions. This is particularly useful in contexts where there's not a lot of access to a diverse diet. And this is an example from Pakistan, where we modeled, it was a particularly resource-constrained environment, and we modeled a 6-monthly short-term intervention of MMP and found that in that case, it actually significantly reduced the cost of the diet for a child 9 to 11 months. It didn't have a very big impact on the cost of the whole household's diet, but for the child, it was really impactful in terms of improving the quality of the diet, but also reducing that cost. Next slide, please. There's a lot of information that's captured within cost of the diet. So one of the other things that you can see from an analysis is what we call the limiting nutrients. So those are the nutrients that it was hardest to meet the requirements for in the analysis. And one of the ways that we use this information is by looking at what are the limiting nutrients, and then are there interventions, are there ways that we could potentially increase the availability of those nutrients via certain foods. So this is an example from Mali, where you can see that there were several limiting micronutrients: calcium, folic acid, iron, zinc, and vitamin C. And the program looked at it in 2 ways. One was looking at kind of wild foods and the availability of wild foods, and looking at which wild foods were good sources of some of these micronutrients that could potentially be promoted through SPCC and other channels. And the other was looking at livelihood interventions that would increase production, consumption, and kind of access via longer-term storing of some of these wild foods, and also some other foods, including fish. So again, that fed into program design. Next slide. This is another example of where cost of diet can help to refine livelihoods type interventions. So this is an example from Bangladesh, where we were doing a home food production or home gardening interventions that were kind of both growing some small amount of veg near your home, and also some small scale poultry or fish aquaculture interventions. And what we did was we modeled the impact based on our kind of yield information of how much the households could produce on the cost of the diet, kind of both individually as interventions and then as a combination or package. And you could see that it didn't have a massive impact on the cost of the diet overall, bringing it down by between 2 and 3%. So while it was a useful intervention in some ways, because the yields were quite small compared to the needs of the household, it didn't have a massive impact on the affordability. Next slide. And this is an example of kind of how we're beginning to explore more with cost of the diet, of looking at kind of more real-time analysis. So the primary data collection process I described, and we'll share a little bit more about the logistics of at the end of the presentation, that that takes time and resource to go out and collect market survey data, and to collect it on all of the foods in the market. But when we do have kind of smaller price data available from either market price monitoring or other sources, we also can look at this type of analysis. So this is an example from Niger, where we had not a full market survey every month, but information on about 20 or so foods and their prices in the market. And we were able to look at the cost of the diet over month by month over a period of about a year and a half. And what's interesting is this was also the period of kind of COVID lockdowns and disruptions. And what we could see from this data was we had a very kind of clear lean season peak in food prices, which is kind of to be expected, kind of towards the mid to late period in the lean season was the kind of highest price in 2020. But then as we continued to monitor in early 2021, what we saw was an unseasonable kind of spike in food prices early in the lean season. And this actually coincided with a period of disruption to markets due to conflict and border closures in this region of Niger, which was quite close to the border with Nigeria. And so this is an example of kind of how also more real-time cost of diet analysis can also be useful for both early warning and triggering, linking to things like early action or kind of early response. Next slide, please. I'm handing back over to Aurélien for this last bit.
Thank you, Lily. So here I will present just this illustrative example on how the cost of the diet tool could be also help inform SBC strategy. As it's shown on this slide, it could provide a wealth of information to help design your SBCC strategy, messages and material. So here we just put one quick example on this cost of the diet that has been conducted in Somalia, in this specific livelihood zone. As you could see, again, we generated the three different diets: energy only, nutritious diet, and the food habit nutritious diet. After the focus group discussions that Lily mentioned in the methodology for data collection, it was observed and reported that avocado, brown rice, beef liver, guava were considered as food taboos. In order to generate the food habit nutritious diet, so we assigned constraints and excluded those foods. As you could see, compared to the nutritious diet cost, the food habit nutritious diet cost, has really significantly increased. I think it's over 3 times. Other example that's how it can inform SBC strategy, how we can use all the information from the cost of the diet on food that has been identified, local food, nutritious local food, but which are underutilized, under-consumed. As I said earlier, how it could also support in the costed recipe development, and I will go back to this point in the next slide. The impact on the impact of the cost of non-breastfeeding children. So this is also something that we could include in the analysis, and this also could be part of the advocacy. So if you recall, we put this as another use of the cost of the diet tool. Next slide, please. Sorry. So here is just a quick example from cost of the diet assessment that has been conducted in Nigeria, where we use some complementary feeding manual that has been developed in 2015, if I'm not wrong. So based from this complementary feeding manual, we adapted this the food demonstration recipe manual and added more recipes which were more contextualized to those specific assessment areas. As a result, 12 recipes were developed using the low-cost ingredients identified by the cost of the diet assessment. And for each recipe, the following was analyzed using the cost of the diet software. So the cost in local currency, USD and GBP for one serving, quantities for nutrients that each serving of a meal provides for the target beneficiary. As you know, for complementary feeding manual, there are different age groups. So there was this disaggregation from child age from 6 to 8, 9 to 11, and 12 to 24 months. And finally, the percentage of the beneficiaries' nutrient requirements that have been met by a serving of the meal. So here just to describe also the use of this tool, how it could inform and adapt, revise any complementary feeding manual recipes that are already existing. Next slide, please. So here it's just to show you the other different uses in terms of advocacy and policy. Lily mentioned about the maternal allowances, the cash transfer programming in Bangladesh, which was help us to influence and to increase the transfer value. The same for Nigeria, where there was a policy change in terms of institutionalization of safety net programming, where one of the states, implementing states in northwest Nigeria, started to implement social protection programming based on the intervention and the program that has been focused on the 1,000 windows days, focusing cash transfer for pregnant lactating women. So based on this program outcome and impact, we managed to influence and ensure change in policy in terms of institutionalization of safety net programming in this specific context. Another use that we mentioned earlier is the research. So this is in part of a research with different partners like Research Institute and International Museum of Kenya. The idea was first to base on the ethnobiological study, so which identify various wild foods that were underutilized and neglected, and they were nutritious and locally available. So based on this first ethnobiological study, we analyze and we conduct this cost of the diet assessment and identify 4 different wild foods. So if I recall, it was 1 leafy vegetable, so wild food, and 3 wild fruits. And based on this analysis, we reported that there was a significant decrease in terms of the food habit nutritious diet. So it comes back again to what we mentioned earlier in terms of how it could inform SBC strategy and how we could better promote the consumption of those underutilized nutritious food that are locally available. Next slide, please. So in terms of resources required for cost of the diet, financial, so the cost will vary according to the assessment area covered, but not only. Also, it will depend on the internal capacity and technical expertise. So if you do have expertise in leading a cost of the diet assessment, approximately, it's really a rough estimation, but we said it's more or less 25,000 USD. But again, it's really based on the assessment area covered, depending on how many villages, markets that you need to cover. And again, if you could use internal staff as a data, as a data collectors. So this will be very much varies on the scope of the area and definitely the internal capacity. In terms of human resources, this is what it's on the guideline, but usually we consider having an assessment leader, a cost of the diet practitioner who will ensure the analysis and the overall quality of the assessment, data collector, supervisor, data entry clerk, and assessment administrator. In terms of time frame, we estimate that a maximum of 6 weeks should be enough. But again, it's really depending on the number of markets that you need to cover and to target. So it will really depend on also the number of food. If your food list have more than, let's say, 120 food items, it will take more time for the data collection team to cover this. But it's a rough estimate. It's based on the guideline that we said that a maximum of 6 weeks. Could be less. Depend mainly upon the length of the data collection, as I just mentioned. Next slide, please. Now we'll hand over to Lily for the last slide.
Thanks, Aurélien. Yeah, this is just kind of to signpost you to a couple of resources. The cost of the diet, we're building a new resource hub, so we've shared that with you. We're still adding content to it, so you'll see more things coming onto it in the coming weeks. There's also a link there to the latest version of the cost of the diet software. In terms of training, there are a couple of different training modules. So we have a pretty standard face-to-face training that takes about 5 days, including kind of field pilot test practicals. We have also developed a bit of an online hybrid training where we have kind of video recorded modules of the training, and it's a bit more self-guided. The time that takes depends basically on the person doing it, because it's kind of down to how quickly you go through. And the inbox there is for any kind of general queries around cost of the diet, either on the software or the training. I should say we're not a huge team. We don't have huge capacities on training and things like that, but we're happy to talk to folks who are interested and also hook you up with other cost of the diet practitioners if it's not something you've done or something you want to get more skilled up in. And I think that's us at time. I haven't seen Sandra come flash, so hopefully that means we're in time. And I'll hand over to the next presenter. Thanks very much.
Thank you, Lily. And yes, we are exactly on time. So over to you, Zebiba.
Thank you, Marina. Next slide, please. So I will present on the cost of the diet use developed by Save the Children and how it's used within the Fill the Nutrient Gap analysis here in WFP, a high-level overview. Next slide, please. So this is the Fill the Nutrient Gap analytical framework. It shows 2 major components of the analysis. The first component being the secondary data review that we do to understand the food system situation, malnutrition situation, nutrition situation in the context where we are doing the analysis in. We look at national level, household level surveys, reports, national programs, national strategies, published research, secondary data review that helps us gain insight into the nutrition and food system situation in that context. And on the right side here is more the technical aspect of the analysis, where we use the cost of the diet tool to estimate the minimum cost of a nutritious diet and whether that cost is affordable or not. And we do this by using food price and food expenditure data. Then this is a highly consultative process. We involve stakeholders across multiple sectors: the health sector, education, agriculture sector, whatever is relevant in that context, and players that influence malnutrition and nutrition outcomes in the country. We involve them through a highly consultative process. And this helps us identify possible interventions and entry points. Then at the end, we model these interventions to see their impact on improving access and affordability of nutritious diet. Next slide, please. This is an overview zooming in onto the analytical aspect in the previous slide. An overview of step-by-step process of the cost of the diet and affordability calculations for F&G objectives. So in the first stage, we use data on locally available food items and their market prices. Later on, I'll go over which types of data sources we use, but mostly the F&G prioritizes the use of secondary data. And in the second stage, we import this data into the software to optimize food combinations and model diets. In the third stage, this will be to obtain the least combination of foods that meets nutrient requirements of all members in the model household. Then in the fourth stage, we compare this calculated cost of the diet to food expenditure to calculate affordability rates. Then in the final stage, we take the suggested interventions, sector-specific interventions, we model them in the software or sometimes outside the software to show their impact on improving access to nutritious diet. This is a very high-level overview of the technical aspect of the cost of the diet within the field and nutrient gap analysis. Next slide, please. And this is a depiction of the typical model households that we use within the field and nutrient gap analysis. It has individuals across the life cycle. We take the life cycle approach. It has been proven to provide a good reference per capita average. It also allows us to conduct analyses as well as modeling for specific individuals and target groups who are vulnerable. So, taking the life cycle approach, it has a breastfeeding child, a school-age child. The school-age child, the age can be increased depending on the context. We also include the adolescent girl, 14 to 15 years of age, a breastfeeding woman, as well as an adult man. So this is the typical model household we use in the field and nutrient gap analysis, but it could also be modified slightly depending on the context. Next slide, please. This is a matrix Aurelian earlier mentioned that shows the different types of diets that are calculated within the software as a default, but also highlighting in gray the types of diets that the field and nutrient gap analysis focuses on. The energy-only diet, and some of this content has already been covered by our colleagues from the Save the Children, but it's included here just to show you in comparison the types of diets that we focus on in the field nutrient gap analysis. So the energy-only diet, it fulfills only the energy needs of the individuals included in the model household. And the macronutrient diet that meets both the energy, protein, and fat needs of the individuals in the model household. The nutritious diets, it meets the 3 macronutrients in addition to the 13 micronutrients. Then comes the staple adjusted nutritious diet, which is relevant in the fill the nutrient gap analysis, is where we adjust the diet for the staple that is locally consumed in the area where we're doing the analyses. And it essentially meets the need of the macronutrients as well as the macronutrients, but it takes into account local preference when it comes to the staples. So it's placed here in between the nutritious diet and the food habits diet because it's kind of an in-between diet. It takes into account local preferences when it comes to staples only, but it also fulfills all the nutrient requirements of the individuals when it comes to both macro and micro nutrients. Then lastly is the food habits nutritious diet explained by our colleagues from the Save the Children. It fulfills the 3 major macronutrients as well as the 13 micronutrients, and it reflects a typical diet that includes the preferences of the local population. Next slide, please. So once we calculate the minimum cost of a nutritious diet, then we look at estimating the affordability, non-affordability. Could be used interchangeably, but this slide summarizes on the x-axis here is plotted percentiles, food expenditure of households. Then on the y-axis is the monthly cost of a nutritious diet, which is represented here by the yellow line. It's plotted against the food expenditure values of that representative population. Then the intersection here indicated by the orange circle is the critical point, because above it, households that land above that cost of the nutritious diet, they are able to afford the cost of a nutritious diet. So not really a focused group for the types of programs that we implement as humanitarian players. However, the households that fall under the yellow line here, with the households with the food expenditure that fall below the cost of a nutritious diet, are our population group of interest, because now we are able to see that they cannot afford the cost of a nutritious diet. So through this comparison between the cost of a nutritious diet and food expenditure, and sometimes consumption used as a proxy as food expenditure, can tell us the proportion of households that cannot afford the cost of a nutritious diet. Then going further into detail is the gray shaded area that's labeled affordability gap, is where we look into the depth, the extent to which non-affordability exists in this population group. So households that land closer to the intersection point, to the center of the expenditure line, are a little bit better off, less vulnerable than households that land to the left, closer to the y-axis, where you see the gap widening. So this is really useful information to be used in targeting more vulnerable population groups with programming, and also in understanding the depth of non-affordability of nutritious diets. Next slide, please. Then in this slide, we look at the Fill the Nutrient Gap Intervention Modeling Framework. We have calculated the cost of a nutritious diet. We have understood the proportion of households that cannot afford this calculated cost. Then what do we do after that is we model interventions. Again, I mentioned earlier, these interventions are identified by stakeholders through a consultative process. It's a multi-sectoral approach. I would like to point out, though, it's not exhaustive, but these in this slide are highlighted the main, usually the typical entry points that we model in the Fill the Nutrient Gap analysis. So starting from the top left quadrant in the blue, increasing household purchasing power, where we enable households to be able to purchase more nutrient-dense foods through programs like cash-based transfers, livelihood support and resilience programs, improved agricultural practices for higher yields, livestock and fisheries related interventions. So we model some of these interventions within the cost of the diet software. Some are done outside the software in Excel, but we try to see what the impact of increasing the household purchasing power would do to enable households to be able to purchase nutritious diet. Going to the right quadrant, where we look at interventions that target vulnerable individuals, such as supplementation with iron folic acid for adolescent girls, pregnant or breastfeeding women, or where we look at the impact of complementary foods for infants between 6 to 23 months of age. We also do a lot of modeling around school meals, where we look at including some nutrient-dense food items within the school meals, then see how the nutrient coverage changes between different types of plates that have different foods in them. We also model the impact of fortified staples being included in school meals. Then going down the framework, the green quadrant, bottom right quadrant, where we look at interventions that increase the availability of nutritious foods, mostly related to agricultural interventions, the impact of crop diversification, supply chain optimization, market-based interventions, where we look at market development activities, and also the impact of reducing post-harvest loss. Then finally, to the bottom left quadrant is the impact of interventions such as increasing nutrient content of foods, large-scale fortification programs, improving transportation and storage of especially temperature-sensitive fresh food items such as fruits and vegetables. What that kind of intervention, what kind of impact those kinds of interventions have on improving affordability and access to nutritious diet. So this is, again, like to point out, it's not exhaustive, but the typical types of interventions that we model within the Fill the Nutrient Gap analyses. Next slide, please. In this slide, just showing you the different, I mentioned earlier, the Fill the Nutrient Gap analysis prioritizes the use of secondary data sources. On the left side here, these are the types of data that we leverage to obtain food prices. Our major food price data source in most contexts being consumer price index, where we extract the food prices for a comprehensive list of foods. Or in other contexts, we use living conditions measurement surveys or national expenditure and consumption surveys to indirectly extract food prices. Sometimes in some contexts, we have used WFP market monitoring data. If none of these secondary data sources are available, or if the secondary data sources for food prices are not, if they don't have a comprehensive list of foods for a cost of the diet analysis, then we resort to primary data collection. On the right side is also sources of secondary data to extract food expenditure values. This will be to use for our affordability estimations. Some of these data sources you can see are overlapping, but they can be used for these both purposes. Yeah, next slide, please. This is, again, a slide showing the type of data source that we use to identify the staple food items and also taboo foods. Earlier, I mentioned the two typical diets that we focus on within the field and nutrient gap analysis are the energy only and the staple adjusted nutritious diet. And how we identify the staples in a given locality is we engage through interviews key informants during the consultations that we carry out in country. Then also, similar to the previous slide, we use household consumption and expenditure surveys, national food production surveys from Ministry of Agriculture, comprehensive food security assessments from WFP. These types of data sources help us identify typically what the staple food items that are consumed in that locality. Earlier, I might have, I think, failed to mention that the staple adjusted nutritious diet takes into account staples, also excludes what are considered taboo foods. And we use these sources to identify what those foods are. Next slide, please. This is a matrix that compares the similarities and differences between the costs of the diet use in the Save the Children approach and how we use, WFP uses the cost of the diet within the fill the nutrient gap analyses. In terms of price data, some of this content, especially the left column, will be a bit repetitive from the presentation from our colleagues from Save the Children, but bear with me. This is to highlight the differences. So price data and food list in the fill the nutrient gap approach, I mentioned we prioritize the use of secondary data, usually nationally representative. But if it's not available, then we resort to primary data collection, whereas the Save the Children use of cost of the diet, it's very localized, focused on the assessment area of interest. They use a very comprehensive, exhaustive food list, and at times also information from early warning and early action systems. Then as far as the scope of analyses, this has also been mentioned, the Save the Children method focuses on livelihood zones, districts, whereas the fill the nutrient gap analysis is usually at the national level, unless there is a request to inform programming in a specific locality. But usually the scope is at the national level. Then the household that we use for the analyses in the fill the nutrient gap is the typical model household that I mentioned earlier that is representative of individuals across the life cycle. It's usually around size of 5 household members, whereas the Save the Children is very much reflective of the typical household in the assessment area. And in terms of the diets calculated, the 4 diets by default that are within the software versus within the field of nutrient gap analysis, we mainly focus on the energy only and the staple adjusted nutritious diet. And as far as estimating non-affordability, we use food expenditure or sometimes food consumption data used as a proxy for food expenditure, and it's calculated outside the software in Excel or Stata, versus the Save the Children approach calculates the non-affordability within the software, and it takes the household economic approach data. Then in terms of application or use of costs of the diet results, the WFP fill the nutrient gap analysis usually is to inform national policies and systems for advocacy and country strategic planning processes, and also program design, whereas the Save the Children method focuses on informing specific programming objectives, such as calculating the transfer values, also for program designs, advocacy, and early warning. Next slide, please. In the next slide, I will mention the specific programming examples where the fill the nutrient gap analyses results from the fill the nutrient gap analyses have been used. The cost of the diet from the Ethiopia fill the nutrient gap analysis has been used to determine transfer value for a fresh food voucher program. This was localized in a certain region in the country, but the values from the cost of the diet were used to inform these transfer values. Then in Mozambique, the food component of the minimum expenditure basket, it was cross-checked with the cost of the diet values. That was done within the fill the nutrient gap analyses. Then in Haiti and South Sudan, the cost of the diet also helps inform the transfer values within the cash for prevention programs. Then finally, also in Mozambique, we have used cost of the diet calculation and also the food basket to advocate for an addition of animal source foods within the a very vegetarian school meal plate. So these are some examples that are program specific. And if you go to the next slide, please. These are also other kind of high level examples of how the fill nutrient gap results inform high level food systems transformation, as well as policy and advocacy purposes. In Pakistan, Tajikistan, and a few other countries, it has helped design, revise national and subnational nutrition and food systems policy. In some contexts, I mentioned earlier, the fill the nutrient gap analysis is a very consultative process that engages stakeholders across multiple sectors. So we use this platform and opportunity to support the engagement towards implementation of existing policies. And in some contexts like Pakistan, Indonesia, Ethiopia, we've used it to inform social and humanitarian assistance programs. We also leverage on this highly consultative process to align strategies of multi-sectoral stakeholders to better serve nutrition outcomes. Within WFP also, we use F&G results to inform country strategic planning processes. Next slide, please. And these are links that have been included as a resource to find out more information on the Fill the Nutrient Gap, as well as access reports that have been published for about, I think, 30 plus countries. And this is where you can access them. And I think that is my last slide. And back to you, Marina.
Thank you so much. It was a very interesting presentation. Indeed, we have many questions in the Q&A box. So I am gonna just kick off with some of them. And there are a couple of questions for Lily and Aurelian that have been posted in the main chat. So I'm gonna read them for you to answer. So the first one is on the cost of the diet presentation. Do you have national level data preloaded? And how often is it updated? I don't know if Lily, you want to answer?
Sure. So I don't know if this is in relation to the food composition data, but I'm going to assume it was. So within the cost of the diet, we've got about 3,500 odd foods within the food databases, and those are food databases from multiple sources. Some of them are country specific, some of them are regional, some of them are global food databases. Excuse me. And so for a lot of times what we find is that you can find food composition that matches the local food composition. You can also add new foods to the cost of the diet. So if you have foods that are specific for your area, for example, we don't have the ability to like upload whole nutrient composition tables. So like if you have a national nutrient, a national food table, for example, right now within the software, that's something I think we're exploring for the future, but you can add individual foods. And typically, because we have quite a lot of foods already there, you can find foods that will be a representative of a lot of the foods that you're looking for, in terms of you can find a food that matches.
Thank you so much. And the next question is, do you have any intention to add sustainability parameters to these analyses and potential for use for nudging?
I'm not sure what sustainability parameters were, so I don't know if the person who asked the question wants to add a little bit more detail there. In terms of nudging, like in a social behavior change communication space, I think there is a lot of data that comes out of cost of diets that can be useful in informing that, whether that's kind of identifying specific kind of underutilized foods, for example, that could do with a bit of a marketing boost. For example, so there is a lot of information within cost of diets that we use when we're kind of designing social behavior change, not just from the cost of diet. We also do formative work, and it's a piece of information you combine with other assessments and analysis.
Thank you, Lily. And if the person that asked the question was trying to find out, wants to come off mute and clarify the bit on sustainability, feel free to just raise your hand. There were a few questions that we wanted to answer live. Can you, Diane, help me to read them?
There's one for Aurélien. Is adding the food habits systematically leading to higher costs when compared to a nutritious diet? And if you could give an example, there is quite a few questions on understanding this difference between diet and diet taking into account food habit. Aurélien?
Yes, thank you, Diane. Yes, for all the assessment, all the cost of the diet assessment that has been conducted, food habit nutritious diet, the cost is always higher than the one for nutritious diet. Why? I try to explain briefly in one slide. Basically, the nutritious diet is based on all those food available at market places. So when you have to conduct market survey in at least six to eight market sites. For the food habit nutritious diet, as we mentioned, it covers also, it's really based on food habits from the primary data collection at household level, where we ask 8 women from each village selected, what are the food habits, food frequency, basically. And we cross-check also with the food focus group discussion. It's where we get all this information on food taboos, food that are consumed for specific age group, and so on. And it's when we add all those constraints in terms of food habits that really like increase significantly the cost of the food habit nutritious diet compared to the one for the nutritious diet, which again is only based on those foods that are available at market, but they don't take consideration about other food available and the food habits.
Erling, could I maybe just add to that?
Sure.
So because the cost of the diet starts from availability and looks for cost optimization. So it's looking at basically the cheapest possible way to meet the requirements that you stated. And in the nutritious diet, we
Lily, you're on mute. Okay,
sorry, don't know how that happened. Thanks. Just to reiterate, the cost of the diet basically is starting from the foods that you've said are available and looking to create something that is cost optimized, so the lowest possible cost given the constraints. The constraints that we put on the nutritious diet are basically just, here are all the foods available, give me the cheapest diet that meets the requirements I've laid out in my family. And so the software can select, the cheapest possible source of different nutrients. And maybe that's something like, sheep stomach and, less preferred foods, because those are actually very cheap sources, or, liver, kidneys, these kinds of things. They're high in vitamin A. They're usually pretty cheap, but they're not foods that people like to eat, very often or at all. And similarly, it may not include the staple foods as much as people like to eat them, because it needs those kilocalories to be dedicated to kind of more nutrient dense foods. So the nutritious diet is kind of just the cheapest possible way to meet the nutrient requirements. And then the food habits diet basically puts those constraints, as Aurélien said, and said, okay, if people don't like to eat this food, don't include it in the diet 3 times a day, or if people always eat this food at least once or twice a day, you have to include at least, 1 or 2 portions. And those constraints then mean that the software has to look for other sources of, it can't take the cheapest source of nutrition, and it often then has to select more expensive foods to meet some of the nutrient requirements, and that's why the price goes up. So hopefully that clarifies. And I think there was another question similarly asking about kind of low personal preferences and things. So hopefully that's answered that question as well.
Thank you very much, Lily and Aurélien. Marina, do you want to answer the one on the FHG and the use of secondary information?
So this question is for Zebiba. I propose to answer live. So Zebiba, do you want to answer to it?
Yes, I was just typing an answer to a different question, but let me see. Is it how recent do secondary information sources have to be? That's a good question. So for the price data, we take very recent. So let's say we are doing an assessment in the month of September, we need price data from the month of September. But for as you may know, to estimate a non-affordability, I mentioned earlier, we use household expenditure data surveys that are not very frequent. Those types of data sets are conducted. Surveys are conducted every maybe 5 years or so, or maybe 2 years if they are very frequent. So in those cases, then we do something what we call a inflation adjustment. So we adjust the expenditure, the food expenditure data to the time of the food price data. And we use adjustment values, and that's how we kind of make it current. It's not recommended, but in case there's not recent data available, then that's the way we use it. But yeah, for food price data, it's very recent.
Thank you.
Marina, do you want to go on with central repository?
Yeah, so I think Aureliane and Lily presented during the Cost of the Diet session. So many reports are available on the Cost of the Diet website. And the link is available in the presentation, but yeah, Lily, Aureliane, any other repository that can be useful?
No, just sorry.
Yeah,
just to clarify, so we've right now there's kind of two Cost of the Diet websites out there in the world, because we're in the process of transitioning from one platform to another. So you may come across two different websites. We've shared the one that's the new one that we're still building, but is going to be kind of the one going forward. And there's also the kind of old one, which is still available for now and will be decommissioning, but has a lot of the old reports. So the resource hub one is the kind of the new central repository for Cost of the Diet. As I said, we're still building it, so we'll be continuing to add content in the coming weeks. But that will be shared. I think it was in the slides, and it'll be shared with the slides.
Thank you, Lily. And very quickly, there are two questions that are unanswered because I think they are a bit unclear, but I'm going to try. There is one question on the kilocalories requirement. They're 2,100 or 2,350. The kilocalories required for each individual at risk really depends on the individuals. So typically pregnant and breastfeeding women, they require more kilocalories. I think it's 280 for pregnant and 450 for breastfeeding, or the contrary. Sorry, I'm not a nutritionist, but they require more kilocalories. And children less. However, you have to keep in mind that the Cost of the Diet will do this calculation automatically based not only on kilocalories, but most importantly on micronutrient requirement for these different type of individuals. And the other question on the MCCT, we target cash transfer value for lactating women with child up to 24 months, as well as government MCCT. Is there any reason to expect the 1,000 days? So the 1,000 day window has a duration, is really the recommended duration for any program that is expecting to see changes in nutritional outcomes based on evidence. There are many projects that have shown that using CVA for nutrition for 1,000 days had positive impact on reducing stunting. So if this is the question, that's the answer that I've tried to give. We are really at time, so I'm gonna hand over to you, Diana, for the closing.
Okay, so we are moving straight to the closing. Just no more question. And Kate, if you can show us the last slide. Not so we will send you this feedback question. If you can answer them, it will be really nice. We need to understand why you are interested and using Cost of Diet, how it can help you for the next step. So we are out of time, so we cannot ask you to answer it now, but if you can give feedback later on, that would be great. Next slide, please. And also, if you can let us know if you think you're going to use the cost of diet tool, that would be really great. And next slide. Okay, so conclusion, just to wrap up, we present you two different approach, methodology, the cost of diet and the field nutrient gap. So cost of both have different purpose. Some are overlapping. Both are looking at how we can understand what is the cost of healthy eating, of healthy nutrition. And you can use some tools for the design of program, like looking at what type of SBCC strategy can be done to the individual level. It can be at national level, like FNG could be used to inform national policy, system analysis, country strategy, planning, formulation, so a lot of things. So clearly there's a lot to learn, and don't hesitate to reach out to us. We put the link in the chat box. Few extra points. We hope you really liked this webinar. Next and last webinar of this series on how to estimate the transfer costs for nutrition will be on December 6th on St. Nicholas, and it will be on the tool NuDval. So we hope you will be able to come. We are asking you, please download this tool. It's an Excel file. Don't worry, the IT are not gonna freak out. It's a very small tool. Please download it, start playing with it, because we will ask you what feedback, we will ask you feedback on how to use it, or how to improve it, etc. So I'm also gonna use this opportunity to share with you the latest publication we had on the frequently asked questions. So please enjoy it. And now it's in the chat box, and we're asking it to be translated in French. So hopefully we will have it in French next year. A big thank you to all the facilitators, Lily, Marina, Aurélien, and Zebiba. A big thank you to our translator, Carmelo, Tim, and Rashid, and also Sanya and Kate that help with the whole organization. So again, thank you very much. It's 4:41 in French, so it's time for a tea break. And I wish you all a happy evening or a nice day if you are based on the other side of the pond. Thank you, guys.
Thank you. Bye.
Thank you, Diane. Thanks, everyone.